have to work on? Yep. Right on left. So which sacral base is the problem?
The right.
Right, and the right is not doing what? Not going forward anterior. That's right. It's not going into the position of right on right mechanics. So we have to correct that. Now again, to help localize here, we're going to utilize that principle of a gapping technique. Okay? So what we're going to do is we're going to get localized in that way first. But what's really the big component here that's going to help us with correction of a backward sacral torsion? What can it do? It can't go. So what elements are we going to have to implement with the legs, the body somehow to? We're going to do a little bit of extension. We're going to do a little bit of extension. We're going to rely even more so, however, though, on a bit of the gapping, okay? Because that sacral base is pretty tough to get forward until we actually gap the back of the SI joint. And we're going to do that by letting one leg drop down to the floor, okay? So if you really walk it through, it starts on page 364. Patient lies left lateral recumbent position, just as the way Lauren is. And I'm going to be standing in front. Why? Because I don't want my patient to roll off the table. And they're going to think they're going to roll off the table. So I'm just letting you know ahead of time. I'm going to pull the left arm anterior. And the reason why I'm going to pull the left arm anterior is because I want to create side bending already to the left of the upper of the lumbar spine. Because when I create side bending this way and I drop the leg down the other way, I'm gapping that whole area for the sacral base to come back. Okay? So I'm doing this, that motion. Okay? We're also going to get localized through some rotation, but the big thing here is we're going to do the gap. So she's starting out, pelvis always has to stay perpendicular to the table. That's the big thing when you're treating the torsions. And we saw how when you didn't do that, they came off balance and it was hard to control your patient. So with the backward sacral torsion, that's what we're going to do. Okay, so first comes first. I want to find my localized space. Okay, I'm going to get down onto the lumbosacral junction. The way that I can do that is just to flex up one of her legs, and there it is. Okay. I'm going to now switch to my monitoring hand. I'm going to take a hold of her right arm. What I often find better to do than what's called the traditional lawnmower pull, where I'm just yanking it like this, I'll actually have her hold over the back of my shoulder and rotate her back like that. And it's not really the rotation as much as it is just pulling the shoulder out from underneath her. Because now what's happening, if I were to have kept her on, you can let your hand rest underneath your hand. If I were to have kept her on her shoulder, then she's relatively side bending to the right side. I want her to side bend left. So by taking her through this maneuver, I help to facilitate that side bending left of the lumbar spine. Okay? Can you see that? Clear enough?
It's more clear if you see right rotation. So you're doing good.
Yes, but the focus here is more on the gap. More on the gap. And the side bend. By taking this shoulder out, her body is allowed to go a little closer to the table. It's causing relative side bending to the left. Now, the next position that I want to get involved with is that tiny bit of extension that we did talk about. And that extension is going to come from, oops, I'm going to have to move this now, position of the legs. So you can relax your legs. I'm going to position you for you. I'm just going to bring it back until I feel extension, right there. That's it. It's enough extension. It's localized to the segment. I'm now going to position this leg here because I'm going to need to grab for it in a little bit. Okay. Now I'm going to lower the table. I'm going to come in local here with my other finger so that I can monitor the lumbosacral junction, and I can also get one finger on the right sacral base. Okay? Now I told you that the gapping is going to be a big part of this correction. So what I need to do is I need to now take this leg Let it straighten out and drop towards the floor. I need to protect her from rolling forward, I need to make contact with my trunk right here to help keep the pelvis perpendicular to the floor and the table. So now I have gapping from above, gapping from below, because of the weight of the leg pulling on the pelvis this way. And all I need to now do, because I'm localized through my segment with extension already, is just ask her to try to lift the leg towards the ceiling that's now straight. Hold, 2, 3, 4, 5, relax. And then drop her down further into position. Okay? And again, yep. 2, 3, 4, 5, relax. And drop her into position. Okay? So the more that she goes into the side bend, Nita, the more the lumbar spine will rotate towards the, if this is neutral now for lumbar spine, even though we've localized with extension from the bottom. Think neutral mechanics. If she's side bending left, she's rotating which way in the lumbar spine? Right. And if she's rotating right, which way is the sacrum rotating? And that's what we're trying to do with this motion. Trying to get the sacrum to rotate left along the left oblique axis because it's positionally posterior or right on left backward sacral torsion. So we localize with that little bit of extension from the bottom. Okay? And we really utilize the nature of the neutral mechanics of the side bending rotation opposite to help us localize with this motion. One more time, lift, hold, 2, 3, 4, 5, relax, 2, 3, and relocalize. That's it. That's it. Some people do get very carried away, I think, with the rotation. They crank them into extension an awful lot, more than they need to. If you're just getting to the feather edge of the barrier and you're already localized, you don't need to do all that extra localization. Joanne?
What's the purpose of this backing over here? Because when we're trying to rotate, we're gonna rotate anterior, right, on the left axis.
We sure are.
So why do we need a gap?
We need to gap because remember the problem with the posterior sacral torsion is more the upper pole.
Okay.
So we need to make a little bit more extra space up high for the sacral base to move forward more freely. If not, it's going to stay posterior and just hit up against the back portion of the innominate.
Well, I don't know, you correct me if I'm wrong, but when we learn in American 2, when we do rotation of the sacral, the innominate actually comes back. And
Go ahead.
I don't know if that's gonna like go against the natural rotation of the sacral.
I think it would, my opinion, would be that you're going to have more that instance when you're doing the localization from the bottom up, because you'll have to take into consideration the innominate more. This localization is coming from the top down. So you're asking the sacrum to do opposite of what the lumbar spine is doing, trying to restore the normal mechanics there. But I can see where you're coming from with the motion of the innominate.
So one more question: what muscle that you're resisting? You actually go straight up, right?
Mm-hmm. So we're resisting the side benders to the right to relax the side benders so that then the sacrum can start to come forward. All right? Good.